All right, let's get right into it. Today, we're taking a deep dive into that little pill so many of us rely on, the allergy pill. Specifically, we're unpacking the science behind cetirizine, the active ingredient in DO1. We're going to find out what's actually going on inside your body when you take one to stop that allergy misery in its tracks. You know the feeling, right? It's a gorgeous day outside, but for you, it's a full-on war zone. The sneezing, the itchy, watery eyes, your body just goes into meltdown mode. So why? Why does something as tiny as a grain of pollen cause such a massive, miserable reaction? Well, it all boils down to one little chemical that causes a whole lot of chaos. So before we can talk about the fix, we've got to understand the problem. Let's break down what's happening during that initial allergy attack, right when that pollen or dust first hits your system. Okay, say hello to the villain of our story, histamine. The best way to think about histamine is like your body's security system, but it's a little overzealous. It sees something totally harmless, like pollen, and thinks it's a major invasion. So it hits the panic button, flooding your system with chemicals that cause all that swelling, redness, and itching. It means well, but it completely overreacts. So there we have it. We have our target. The strategy to feel better becomes pretty simple then. If you want to stop the symptoms, you have to stop the histamine. But here's the thing. Not all histamine blockers are created equal. The first ones on the scene, the first-generation drugs, they worked, but they were like these sleepy security guards. Yeah, they'd stop the alarm, but then they'd basically pass out, crossing into your brain and making you super drowsy. The newer second-generation guys, they're the alert guards. They were specifically designed to stay in the body and out of the brain as much as possible. And that brings us to the hero of today's story, cetirizine. This is our alert guard, and it's the key ingredient that really changed the game for allergy sufferers. Now, what's so clever about cetirizine is its origin story. It was actually developed from an older, much drowsier drug. Scientists figured out how to isolate the part that did all the allergy fighting while leaving behind most of the stuff that made people so sleepy. The end result? You get the powerful relief you need without that heavy, can't keep your eyes open feeling. So how exactly does our hero pull this off? How does it actually fight back against histamine at the molecular level? This is where it gets really interesting. It all comes down to a tiny showdown happening on the surface of your cells. Just think of it like a lock and key. Your cells have these little docking stations, or locks, called H1 receptors. Histamine is the key that fits perfectly into those locks. When it clicks in, bam, allergy symptoms get triggered. But cetirizine is like a molecular shield. It swoops in and plugs up those locks first. So when histamine comes rushing in, there's nowhere for it to go. The key can't get into the lock, and the allergic reaction is stopped before it can even start. Okay, the science is cool, for sure. But what does this all mean for you when you actually take the pill? Let's get practical and walk through the essential user's guide. So, you take a tablet, and it gets to work fast. It hits its peak allergy-fighting power in your bloodstream in just about an hour. It hangs around for a while, with a half-life of about 8 to 10 hours. And here's a really interesting part. Your liver barely touches it. Most of it, around 70%, gets filtered out directly by your kidneys and leaves your body unchanged. And that's a huge clue as to why your kidney health is so important when taking this medication. 24. That's it. That's the number. And it's one of the biggest reasons this drug is so popular. It stands for the number of hours of relief you can expect from a single dose. That long-lasting action is what makes it so convenient. One pill and you're good for the whole day. So what's on its hit list? Well, just about everything you can think of. It takes on seasonal hay fever, those year-round allergies from things like dust and pets. It's also really effective for chronic hives, itchy eyes from allergic conjunctivitis, and even helps calm down reactions from insect bites. Now, no drug is perfect, right? Even though it's designed to be non-sedating, some people can still feel a bit drowsy or tired. Dry mouth and headaches are also pretty common. It really depends on how your own body reacts. Of course, more serious reactions are very rare, but it's always smart to know what to look out for. Okay, this is absolutely crucial, so listen up. Because it can still cause some drowsiness, mixing it with alcohol or other sedatives is a really bad idea. It can just magnify that effect big time. And remember how we talked about the kidneys doing all the work to clear it out? That's why it is an absolute no-go for anyone with severe kidney problems. For most adults and kids over 12, the standard dose is simple, 10 milligrams once a day. For younger kids, it's usually about half that. And one more time, because it's so important, For anyone with kidney or even liver issues, that dose absolutely has to be adjusted by a doctor to keep things safe. So when you put it all together, that targeted action, the 24-hour relief, and the much lower risk of side effects, you can really see why cetirizine is such a pillar of modern allergy treatment. And this quote right here, this really hits the nail on the head. It sums up the biggest real-world advantage. When a medicine doesn't make you feel drowsy or out of it, you're just more likely to actually take it every day. You can drive, you can work, you can live your life. And that consistency is what leads to way better control over your allergies. All of this leaves you with the pretty exciting thought, doesn't it? As our drugs get smarter and more targeted, are we heading towards a future where chronic allergies aren't this big, debilitating problem anymore? A future where they're just a minor annoyance that you can easily manage? It's a really promising look at where things are going. Thanks so much for tuning in.